Good day, everyone. I, Dariann Samaniego, with Miss Castillo, Miss Flores, Miss Juanata, Miss Peria, and Miss Soriano are here to present our case study about hereditary fructose intolerance. And without much ado, let's continue on with the abstract. An autosomal recessive disease, HFI, or hereditary fructose intolerance, is a metabolic disease caused by a deficiency of aldolase B. It is said that in glycolysis, fructose 1 phosphate is formed from ingested fructose and will then be converted to glyceraldehyde 3 phosphate. But before we continue, let us first know what fructose 1 phosphate is, since we are about to hear it a couple of times here in our case study. Fructose 1 phosphate is a derivative of fructose, which is an important intermediate in glucose metabolism. And the block of aldolase B causes an accumulation of this fructose 1 phosphate, resulting to severe hypoglycemia or the low blood sugar and the buildup of dangerous substances in the liver and even in the kidney. This condition is caused by genetic changes in the ALDOB gene, and accordingly, the best treatment to this is a strict free fructose diet with the help of enzymatic assay and fructose intolerance testing Melbourne and diagnosing HFI, in which you will hear more in the succeeding parts.
Hereditary fructose intolerance, or also known as fructose 1-phosphate aldolase deficiency, is an inherited metabolic disease affecting an individual's ability to digest fructose, a common sugar found in fruits. This condition is caused by the absence of aldolase B or fructose 1,6-biphosphate aldolase. It is an enzyme in charge of the second step in the metabolism of fructose that converts fructose 1-phosphate into glyceraldehyde and dihydroxyacetone phosphate. It has negative implications on the kidney, liver, and intestines when people with HFI ingest fructose. This condition manifests during infancy at weaning, when the child is introduced to fruits and vegetables, or when feeding is transferred from breast milk to artificial nutrients. The symptoms that may appear are abdominal pain, nausea, vomiting, and excessive sleepiness. Acute intake might result in hypoglycemia and gastrointestinal disturbances. Persistent consumption can lead to impaired hepatic or renal function and interfere with growth at the normal rate for children with HFI. This condition poses a life-threatening risk in infants and mild to severe in older children and adults.
So next is pathophysiology. Here's a illustration of fructose metabolism. So as you can see here, when the fructose enter the liver, it is normally metabolized. It is phosphorylated by the fructose kinase to make fructose 1-phosphate, and fructose 1-phosphate is changed by the enzyme aldolase B into DHAP, and glyceraldehyde that allows it to enter glycolysis to make ATP, and it will form glycogen for storage. So this chemical procedure is a part of sugar metabolism, which serves as the body's primary energy generating mechanism. Although fructose 1-phosphate also can be used as a signal in the liver, and it signals for high blood sugar. However, a deficiency of the enzyme aldose B causes fructose 1-phosphate to accumulate in the liver, kidney, and small intestines, which result in fructose intolerance and causes severe hypoglycemia. Hereditary fructose intolerance, or HFI, is unusual but fatal inherited fructose metabolism disorder caused by mutation in aldolase B gene. A person will not usually show symptoms if he or she inherits a normal gene and one disease gene. Therefore, this person will be a carrier of the disease. But if both parents carry the non-working copy of the aldolase B gene, each of their children has a 25% chance of being affected. So early diagnosis of HFI is essential because most people with HFI can live normal lives if they follow a fructose-free diet. But if it is left untreated, the condition can cause permanent physical harm, particularly serious damage in the liver and kidney.
For the diagnosis, hereditary fructose intolerance can be definitely confirmed by either of two tests such as enzymatic assay and fructose intolerance testing. So for enzymatic assay, it is a method for determining the activities of aldolase which requires an invasive surgical procedure called liver biopsy to collect the aldolase from the patient's liver tissue. To make it clear, aldolase is an enzyme found mainly in the skeletal muscles, brain, and liver. So aldolase A is found in the muscle and red blood cells. Then aldolase B is found in liver, kidney, and small intestine. And aldolase C is found in brain and neuronal tissue. Aldolase is a protein that helps in the breakdown of certain carbohydrates to provide energy. As I've said earlier, enzymatic assay is a method for determining the activities of aldolase, meaning to say, these tests will show if a patient has an absence of aldolase B, which can lead to hereditary fructose intolerance. So next is fructose intolerance testing, or also known as fructose intolerance breathing test. In this test, it will show how patients metabolize a specific sugar or carbohydrate such as lactose or fructose. So as patients exhale, the test analyzes the breath regularly and measures the amount and distributions of hydrogen produced. This indicates whether patients have problems absorbing fructose. In the second stage of the metabolism of fructose, aldolase B is in charge of converting the compound fructose 1-phosphate into glyceraldehyde and deoxyacetone phosphate. So aldolase B is also involved in the breakdown of simple sugar to a lesser degree. Therefore, if a patient has a problem in absorbing fructose, meaning to say the patient has an absence of aldolase B. Again, hereditary fructose intolerance can be definitely confirmed by either of two tests, such as enzymatic assay and fructose intolerance testing. However, each of these procedures entails a considerable risk, particularly for a newborn child. Therefore, a non-invasive DNA test is frequently advised.
So as for the epidemiology, we have two, the local, which is the Philippines, and global. So first is the local. Based on interpolation of the most recent United Nations data, the Philippines' current population is 113,002,674 as of October 31, 2022. So, hypoglycemia can be caused by hereditary fructose intolerance. Here in the Philippines, there is an 8.9 incidence of hypoglycemia. So, we can say that hereditary fructose intolerance here in the Philippines is very rare. So globally, hereditary fructose intolerance is estimated to affect 1 in 20,000 to 30,000 people worldwide each year. So the first incident rate was reported from Switzerland, where 5 cases of HFI were reported over a 5-year period involving 100,000 births. So, HFI is a metabolic disorder that usually appears around age of 4 to 6 months when weaning begins. The inheritance pattern is autosomal recessive, and having a child with HFI has a 25% or 1 in 4 chance if both parents are heterozygotes or if both parents have non-working copy of the adolase B gene.
And for the treatments, one of the standard treatments for patients with hereditary fructose intolerance or HFI is eliminating fructose from their diet or adhering to a strict fructose free diet that forbids the consumption of anything that contains fructose, sucrose, or sorbitol, the latter of which is most commonly found in candies and gums. And when it comes to the consumption of food, Dr. L. Schreck of the University of Tripoli advised patients to first examine ingredients list in order to avoid consuming fructose containing meals. And according to him, Here are the food that should be avoided. First one is fruit with a high fructose content, such as watermelons, apples, and mangoes. Also, sweeteners should be avoided, such as those found in foods high in fructose corn syrup, soda, packaged desserts, and some sports drinks. Nevertheless, with all the prohibited foods mentioned, the experts still believe that people with this condition and diet may still lead normal and healthy lives, but only if they strictly follow a fructose free diet. Therefore, to produce balanced meals without having to worry about the fructose intake level, the University of Virginia Health System suggests including meat, dairy, eggs, beans, and vegetables in their diet. The Mayo Clinic also recommends considering consulting with a dietitian so they can be advised on which meals to consume and which to avoid. Additionally, when it comes to treatments, a liver transplant may be performed when liver damages reaches a critical point. And here are the references we used. And that would be it. Thank you for listening.